Hello, welcome back everybody. Dr. Scott Peters, your local foot and ankle specialist. So we're back with our top 5 questions of the week and some pretty interesting questions this week. First question of the week is regarding neuromas. What is a neuroma? We have talked about neuromas in the past, but apparently you guys didn't get it. So I'm gonna share it with you a little bit more. What is a neuroma? That question can be answered in a few different ways. What is it? To a layperson, it's pain under the ball of the foot. Oftentimes it radiates into the toes, and it's forefoot pain. In general terms, it's inflammation of a nerve near the toes, under the ball of the foot, on the bottom. In more specific terms, it's referred to as perineural fibrosis. So not only is there a inflammatory component to it, but it seems that the nerve almost has a protective mechanism. So if there's repeated trauma to it, over time it will start to form scar tissue around it. And that's what we call the neuroma. Neuromas are also referred to as Morton's neuroma and interdigital neuromas, and we're just going to refer to it as a neuroma. The suffix oma, O-M-A, refers to a growth or a tumor. So in its most basic sense, it is an enlargement of the nerve, so we call it a neuroma. So how do you know if you have a neuroma? My basic rule of thumb is if you are young and you have forefoot pain, it's a neuroma until proven otherwise. Obviously, if it's regarding the big toe, it's probably not a neuroma. It's much more common to see neuromas involving your second, third, and fourth toes. Very rarely do you ever see it involving the large toe or the fifth toe, the small toe. Neuromas are very common in runners, in walkers. People are putting mileage on their feet. People who cover a lot of distance. In my practice, there's a couple large factories in the area, and there are people who are working on a line and they're on their feet all day, and it's very common, that type of patient as well. But the symptoms of neuroma are very predictable. Usually it feels like there is a lump underneath your foot. Many people say it feels like my sock is bunched up underneath my toes, but when they check, it's not. Other people will describe burning or a little bit of radiating into the toes, but any of those symptoms are usually definitive for a neuroma. The patients that were specifically speaking to me about neuromas this week were very concerned about surgery. A couple of them wanted surgery, wanted me to take them right to the OR and take it out. And a couple other patients, absolutely not, under no circumstances did they want surgery, and we'll try anything else, otherwise I'll just live with it. So there are a lot of ways to skin this cat. It used to be, earlier in my practice, I used to take out neuromas 4 or 5 a week. Now if I take out 4 or 5 in a year, it's a lot. It's just usually not necessary. In fact, I would say probably the people I end up surgically excising them on are the people who've had them for years and just never did anything about them. The long-standing neuroma tends to be a little more recalcitrant to treatment. Okay, so first and foremost, when it comes to treating them, let's just talk about conservatively. One, you have to make sure you're wearing the right shoes because certain shoes will really cause pain. Usually going barefoot exacerbates the pain as well. But when you talk about pain from being barefoot, it's because there's direct pressure on the bottom of the foot, and a hard floor is much more likely to aggravate that nerve that's inflamed. When it comes to shoes, you do not want a shoe that is going to compress the first and fifth toes together towards the center. Most shoes do that to some degree. Most shoes do not have square toes. You have to find a shoe that has enough width for your foot. And a lot of times the key is just having enough volume in the shoe for your foot to occupy it. So if you have neuroma symptoms, you cannot wear a shoe that is narrow. If it's too narrow, you're gonna have problems. Okay, beyond shoe gear, often anti-inflammatories, whether they're non-steroidals or whether it's a steroid like a Medrol dose pack, oftentimes that's all a person needs. Usually that will work more consistently and more predictably if it's a short-lived or acute set of neuroma symptoms. If it's long-standing, you're probably not going to have as much success with it. Beyond that, you can get steroid injections. Steroid injections, from 1 to 3 steroid injections, maybe 4 or 5 if necessary, as long as you're getting improvement with each one. Those will usually put the matter to rest. And people ask me all the time, is that putting a Band-Aid on it? No, it's not putting a Band-Aid on it. If the problem is inflammation and you get rid of the inflammation, then the symptoms are gone and the problem is gone. And people say, will it come back? Patients ask me all the time, will it come back? You could get a neuroma anytime in your life. It's not like once you have it, you can't get it anymore. But I wouldn't call it coming back. Just like if you had a a cold in August, a summer cold that lasted for a couple of weeks, and then in February, in the middle of winter, you get a cold, you wouldn't say, oh, my cold came back again. That's how I look at it. Big question. Is this going to hurt? So if I'm going to give you an injection, is it going to hurt? My goal is to give you an injection. I have two goals when I give an injection. One is to make it work, and number two is to make you not have any pain. Those are my two goals when I give you an injection. I have my own way of giving Neuroma injections, and we have a lot of success. I don't remember the last time I had a patient say ow when I was giving him a Neuroma injection, let alone let out a scream. It's not common, it's not necessary, although I have had patients tell me, and I feel good about this, it's always very flattering to me, but I've had patients tell me that the last time they had one of those, it was the most painful experience they ever had, and that's why they were here today. So do I give injections better than other doctors? Probably, but I also have my own special technique for doing it, and so I think that's really what gives people a painless experience. What if I adjusted my shoes and you gave me 3 or 4 injections and I have no relief? I've tried icing, which also can be very helpful. I've tried icing and I've tried modifying my shoe gear. What's next? So I've tried everything you've offered me, doc, and it still isn't working. Okay, so at that point, we're probably going to try and get you into a custom orthotic, which is an insert that goes in your shoe. And a lot of times you can make an accommodation in that orthotic that will specifically address the neuroma, and people often do very well with those. The reason I don't make that a front line or first line treatment modality is because a lot of times it's insurance dependent, meaning patients won't do it if it's not covered. Maybe half the plans out there cover custom orthotics and half the plans don't. I don't necessarily recommend buying over-the-counter orthotics for a neuroma or for the symptoms of a neuroma, because it really is kind of a different animal, and the over-the-counter devices can worsen the situation, and so it's not worth spending $15 to $30 and then trying a different type and spending another $15 to $30. You're better off just going with standard treatments in the doctor's office. And beyond that, so what's after orthotics? Is there anything else? So yeah, so there is a non-surgical way to destroy the neuroma, for lack of a better term. So we can inject a chemical into the inner space where the where the neuroma is located, and that will destroy the nerve completely. And so if the nerve is gone, the symptoms are gone. Do you need the nerve? It's a sensory nerve. It doesn't control any muscular function. So, people are always concerned, am I going to lose sensation? It's usually only sensation to one small area on one side of a toe and maybe the adjacent side of the toe. I have never had a patient go through that and tell me they had a decrease in sensation or any feelings of numbness or anything like that. When it works, it works. It also does not always work. It's not 100%. And so if that fails, then we're looking at a surgical excision. Surgical excision works. It's not 100% either. And the reason is because there are certain complications that could develop. You could remove it, and if you leave a little piece of it, it could form a little stump that still carries nerve impulses, and so that can still be painful. I've never had one develop, but I have seen them. I've had patients come in that had that. And good luck trying to take that out, because that is literally like looking for a needle in a haystack. My final thought on neuromas is we get x-rays for that. You can't see a neuroma on an x-ray, so it makes perfect sense that we would get an x-ray for it, correct? No, obviously not. But if a person has forefoot pain and they not have a neuroma, it's most likely that they either have a stress fracture or they have arthritis in their toe joints. And so those two things we will be able to see on an x-ray, but you can't see a neuroma on an x-ray. Okay, question number 2. It's a little uncomfortable for me to talk about because it's something that's becoming very popular and trendy. It's been well marketed and probably over marketed, but that is a very specific bunionectomy procedure. And I have had, I don't even know, countless patients come in and tell me they want a Lapiplasty to fix their bunion. And so it's very uncommon and unusual to have patients come in and tell you what surgical procedure they want for anything. I mean, maybe like a vasectomy, which obviously is for a very specific reason. But I don't even know of patients that go to their doctor and say to their ophthalmologist, I want my cataract removed. First, they have to know that they have a cataract. Unusual, unlikely, and uncommon to have somebody come in and say, I'd like a Lapiplasty, can you do that surgery? Do you do that? And so let me tell you about a Lapiplasty. A Lapiplasty is really just a modification of the equipment used to fix a bunionectomy. There have been many procedures over the years that have tried to address the fact that bunion deformities occur in more than one of the three cardinal planes. And so there are many excellent procedures that effectively repair multiplanar deformities that we call bunions. The Lapiplasty is an attempt to repair it in all three planes, and by and large, if it's done correctly, it will do that. It is not the only procedure that does that. So a Lapiplasty addresses a bunion deformity in multiple planes in the following way. A bunion tends not only to be a deviation of this metatarsal away from the others and the toe drifts in, but it also tends to rotate. So when it does that, fixing it by just shaving off the bump or just moving the metatarsal back towards the other doesn't address the problem with the rotation. A Lapiplasty does. It is a good procedure. It's probably a more technically difficult procedure than some of your other garden variety bunionectomies because you just don't do them as often. And the problem is there are doctors that are trying to make them your garden variety procedure, and it's oftentimes overkill. I've had patients that literally they do only need their bump shaved, and there's like no angle between the first and second metatarsal, and let alone an exaggerated angle, and they were coming for a second opinion on whether they should have the Lapiplasty done. It is not a procedure to be taken lightly. It is a major foot procedure. What the Lapiplasty does is it fuses the first metatarsal cuneiform joint. So these two bones will become one bone. And there's another procedure that it's sort of taken the name from called the Lapidus procedure. The Lapidus procedure was a first metatarsal cuneiform arthrodesis or fusion that was probably described 100 years ago, probably literally in the early 1900s, 1910, 1911, somewhere around there. And it is a tried and true procedure. It works very nicely. It fixes bunions and it fixes severe bunion deformities. It is not meant for a mild bunion deformity. It also is primarily for bunion deformity where that cuneiform bone is uncommonly shaped. It's shaped more triangular and doesn't have a flat surface for the metatarsal to articulate with. In that situation, the Lapidus procedure works very nicely. There are some complications that can develop with a Lapidus procedure, but most surgeons that do a lot of Lapidus procedures know how to reduce the risk of those, and it's a very predictable outcome, and patients do very well. That said, the Lapidus itself had become a very trendy procedure and was probably being overused, and I think the most complications I've seen from other doctors when the patients come into my office, I think most commonly it's because the doctor was overcorrecting something. The deformity was not that bad and they went with a big procedure for it and it didn't work out well for them. So again, with regards to Lapiplasty, is there a place for it? Absolutely, absolutely. The fixation that is used for it is key to making it successful. It can easily have very similar problems to a Lapidus procedure. It can also have problems that are similar if you choose the wrong patient to perform it on. So again, selecting the right procedure for the right patient is key. It's essential. And with regards to the Lapiplasty, it might not be conducive to your lifestyle. I have a lot of patients that are working and they can't take a lot of time off work. So you can offer them one of three things. You can say, listen, if you can't take the 6 to 8 weeks off that you will need to recover from a Lapiplasty, then you're down to two choices. You can either not have surgery and live with the pain, or we could do a procedure that will not be as comprehensive and you might not get the absolute optimal outcome, but you might have pain relief for the rest of your life. And in that situation, you might only be off your feet for 17 days or 2 weeks, however long it takes until the doctor takes the sutures out and lets them back into a regular work type boot or shoe. Find ourselves as surgeons having to weigh all the factors of your lifestyle to make the right decision. I'm not an advocate of doing a procedure that is less comprehensive than is necessary. I'm not an advocate of recommending procedures that are less comprehensive than necessary to address the deformity. However, if I know you're not going to be retiring for 20 to 30 years, So you're going to be living with this pain until then, and you need relief. I am willing to compromise if you are, and obviously I would only do that with a procedure that I feel very confident will give you long-term relief and will have great success. So it's very important at the end of the day that all these factors are discussed with your doctor, and you have to have the right chemistry with your doctor to be able to discuss those things openly and comfortably. And if you do not feel comfortable discussing those issues with a doctor, then you probably should get a second opinion or switch doctors. Okay, question number 3. My homeopathic doctor or my naturopathic doctor, my chiropractor, my holistic healer told me this. I think most doctors do not enjoy contradicting other doctors or other people that you have confidence in, but there are times when you can't really avoid it. I'm not one to chop the legs out from underneath another doctor, and so people ask me all the time about alternative treatments. Acupuncture is a big thing. And look, there's enough people out there that have benefited from acupuncture that how could I say it's not a reasonable treatment? Sure, if you've run out of options, then as far as I'm concerned, absolutely try some of those other approaches. However, you have to use common sense. So I have 2 stories that I'm going to share with you. Briefly, years ago, I was working out in a gym, and there was a fellow there, and from time to time, we would end up spotting each other on the bench or something, and we never really made conversation. We were just literally kind of friendly in the gym. And one day, I introduced myself, he introduced himself, and I said, "What do you do for a living?" And he said, "I'm a chiropractor." And I said, "Oh, wow." I said, "That's interesting." And he said, "What do you do for a living?" I told him, "I'm a podiatrist." And a match was made. You know, we were very happy to talk to each other. And he said to me, "I would love you to work out of my office. Is there any chance I could get you in my office?" He's like, "I do terribly when it comes to feet. I never am able to bring people any kind of sustained relief with foot problems." And in my head, I was thinking, well, that's because you're a chiropractor. You should be doing back problems, right? Like, that's your specialty. And I know that chiropractors will tell you that many other things are affected by your spine. I'm not going to argue that or even discuss that. That's for a topic for a different day. At that time, I was working for someone. I asked my boss if I could go spend some time in that doctor's office. He told me I'd have him lined up out the door. If you come to my office, I'll have him lined up out the door for you. So she said to me, "You know what, why don't you try it a half day a week? See how that works out, and if it seems like you're generating some business, I'll let you expand it." So that's what I did. And I got there, and his office was kind of in the country, and I got there, and it was like in a sort of in a strip mall, but not your classic strip mall. They were like selling concert tickets or something, and I'm walking in and out of these people, "Excuse me, pardon me, excuse me." Finally, I make my way to the office, and I introduce myself to the receptionist, and she calls the doctor. He comes out and he greets me with a warm greeting, and I mean, just a really very affable character. And I go in and I said, "What's going on outside? There are so many people in that line." And he goes, "They're here to see you." I said, "Those are the patients?" And he's like, "Yeah, though, I told you I'd have them lined up out the door." I'm like, "It's lined up down the parking lot. You know I'm only here for 2.5 hours. And he said, "I know, better get to work." One of the patients I saw was an elderly woman, and I asked her how she was doing, how her health was, and she told me that she's doing much better now, but she just recovered from an infection in her heart. So I asked her what hospital she was in, and she told me I wasn't in the hospital. "What antibiotics were you taking? Are you still taking them?" "I never took antibiotics." And I said, "You had a bacterial endocarditis, and you weren't in the hospital, you didn't get antibiotics. What did you do?" "Dr. So-and-so treated me." And she was referring to the chiropractor whose office I was working out of that day. "He diagnosed you an endocarditis, and he treated you?" "Yes." "How did he treat you?" "He did some adjustments and manipulations, and, you know, thank God, everything's working fine." Okay, so I'm very uncomfortable with that situation. You can imagine if you are a traditional doctor, that would make you very uncomfortable. So after this crazy day of seeing 1 billion patients in 2.5 hours, he and I had a few minutes to talk, and I asked him specifically about that patient. I said, "Did you diagnose her with an endocarditis?" And he said, "Yeah, it was a crazy thing." And I said, "How did you make that diagnosis?" "Physical exam." And I said, "How did you physically know that her heart was infected?" And he said, "It felt heavy." And as you're thinking right now, what felt heavy? I was thinking the same thing. And he said, "Her chest felt heavy." "Did you pick her up by her chest?" And he said, no, her breast felt heavy. Okay, so trying not to be cynical, I said, had you ever felt her breast before? No. And I said, well, then how do you know it felt heavier than usual? No. He said, it was warm. And yeah, I mean, she definitely had an infection. And I had asked her what her symptoms were, and she said, I didn't have any symptoms. That was the miracle that he found it, because I could have been in really big trouble. He had no symptoms, and you made this diagnosis. Yes. And how'd you treat it? I made some adjustments. So by the time I got done with him, I recognized the fact there are two different types of chiropractors. There are those that truly believe that if your spinal column is in order, if it is intact, in alignment, then everything's going to function great. You won't get sick. You shouldn't get sick. You should not have any problems, because your immune system will be ready to fight off the Chinese army. And then there are those that believe that if you have neck pain or back pain, they can help you. Maybe hip pain also, anything that's along the core. I'm much more comfortable with that approach. Second story. I had a patient who came in with bunions, bad bunions. Literally, she couldn't fit them in her shoes. She had to cut like a little hole for her bunions on the inside of both of her shoes, on all her shoes, because there was no way to fit them in her shoes. She told me she didn't want to go to a foot doctor because her holistic healer had told her that all they're going to do is surgery and you're going to regret it for the rest of your life. I said, so what was the treatment he recommended? And she said, I'm not going to tell you. And I said, you're not going to tell me? That's right. Why not? Because you're going to laugh at me. I said, you're worried I'm going to laugh at you? So she said to me, I'll tell you only if you promise not to laugh. And so then she told me that he had her soaking her bunions in her own urine 3 times a day. Now, I didn't laugh. I almost gagged, but I was thinking, my first thought was, how exactly do you do that? And that came off my tongue. She said, what do you mean? I'm like, were you peeing in a basin and saving that and adding to it later in the day, and every time you had to go, you would just add to that, so you were freshening it up all the time? Or you could only do it when you had to go to the bathroom, and like, were you doing it in the toilet? How were you soaking your foot in that? And she wouldn't tell me the answer to that question. But she did tell me that it didn't do a darn thing for her bunions. Surprise. Your holistic healer, your naturopathic doctor, your chiropractor might be able to make it sound reasonable that it's a natural substance from within your body, and I don't know what else they would say, but they could say things that might make you think maybe it could work. It won't. Do not soak your body parts in urine, and do not soak your body parts in feces or blood or anything else that's like that. Do not do it. Get another opinion before you try it. That is my opinion on other types of doctors. So I hope you'll take those words seriously and understand that even though today, the boundaries of what's medicine and what's not medicine have been expanded and pushed, and my feeling is you have to maintain a middle-of-the-road common sense. And if you don't, you'll find yourself soaking your feet in urine before you know it. Okay, so question number 4. This only happened twice this week, but it happened twice this week, and it happens probably every week. I'll see a patient and they'll say, Doc, I don't know what happened, but I hurt myself really badly, or I was playing soccer, or I was running, and I felt a pop or crack, and immediately, like, it sat me down. It was so much pain. But I know I didn't break it because I'm walking on it. So what do you think it is? What else could it be besides a fracture, besides a broken bone? So let me dispel this thought, and I don't know why this thought even exists, but there's no such thing as I can walk on it so it's not broken. You can walk on broken bones. There's no reason why you couldn't. If you walk on a broken bone, it will hurt. And so if something happens and you hear something in your foot crack or pop or tear, it doesn't mean something didn't crack or pop or tear. It probably did. And just because you're able to hop along or carry on with some weight bearing, that does not mean that there was not damage done. And so you have to use common sense. You have to pay attention to what just happened and kind of analyze it. And just because you're so-called ambulating, right? Even though you're schlepping your own foot while you're walking, you have to lift it with your own hands. That's not called walking. That's called just getting along. And so if you're limping on it, that's not called walking either. So you could injure yourself badly enough to limp and not have a broken bone, but you could certainly have a broken bone. And what comes from that, the worst case scenario is like this week. This guy had twisted his ankle, and he broke his fibula. It needs to be fixed, and I need to put a plate on the back of his ankle. But he's walking on it, and so he thought there's no way it was broken. But the question is, like, how much did it move or shift in the 2.5 weeks that he was walking on it, thinking it can't be broken? And maybe he wouldn't have needed a plate on it 2 weeks ago if he had just come in right away. So if you hear something pop, crack, or tear, or if you just hurt yourself very badly and you think it's not broken because you're somewhat ambulating on it, that doesn't mean it's not broken or torn. Get in, get an x-ray, and you'll save yourself a lot of headaches. Okay, question number 5, and it might be the most common question I get, actually. Doc, I have arthritis all over my body. I'm sure this is just arthritis, but can you tell me if it is? So take some x-rays and you push around on their foot and you figure out exactly where the pain is located and what's causing it. And then if the x-rays show that there's arthritis on it, you know, that the joints have degenerated, they're breaking down, okay, so it's arthritis. There seems to be an idea out there that arthritis is something you have to live with. It is true that the damage done by joints breaking down over time, wear and tear arthritis, or any kind of arthritis, whatever is damaged is there. That damage remains. But it doesn't mean the symptoms have to remain. Oftentimes we can treat the symptoms and make patients much more comfortable. Let's say a patient is experiencing a lot of pain in their big toe joint. If you can give them a 50% reduction in their pain, it changes their lifestyle completely. They go from being able to do nothing to being able to do most of the things they want to do. It's worthwhile to treat arthritis. I actually have a lot of colleagues that seem to tell patients, you have arthritis, there's nothing we can do about it. And I have one colleague in the area who I hold in very high regard, and she seems to tell people that frequently. And I never understand, like, you're not going to try anything to reduce their symptoms? Arthritis is an inflammation of the joint. They've had the arthritis building for years. You can look at the x-rays and you see it's completely destroyed. But their symptoms have come about recently. So if it's just an acute flare of the fact that the joint is not working the way it's supposed to, a lot of times you can put them on an anti-inflammatory or have them icing properly, and their symptoms can diminish greatly, and what a relief for them. Other times you can give steroid injections and they'll feel much better. I have a patient that came in this past Tuesday and told me he needs another injection. I didn't remember ever giving him an injection. So I looked in his chart, and sure enough, 2.5 years ago I gave him an injection for arthritis in his second toe joint. And he said it was fine until about a week and a half ago, and now he's having a lot of trouble with it. Okay, we'll give him another injection. And if it holds up for another 2.5 years, that'd be great. So don't think just because you have arthritis, it's a lost cause and you gotta live with it. That could be the case. I'm not telling you that in every case we can, give you a great relief of your symptoms, but most of the time you can. I would say most of the time, the vast majority of the time, there are ways to address it. And many times there are ways to address it surgically. So if you're in a situation where you've got debilitating arthritis and you still need to be active, there are surgeries that address arthritis, and you could dramatically improve your lifestyle. And we are all about dramatically improving our lifestyle at any age. So I'm with you on that. And if you have any questions about that, you could click the link below and make an appointment to talk to me at our ankle and foot virtual clinic, or you could send me an email, but I'd be happy to talk about that. Many times we can give you some really profound relief of arthritis. And so to not try it would be foolish. So those are the top 5 questions for today. If you liked what you heard, hit the like button, subscribe, send it to your friends, share it with your friends. If you know anybody that's having foot problems, that's complaining to you all the time, you can tell them, complain to this guy, and send it to them. I look forward to hearing from you, and I hope that you found this helpful, and I'll look forward to seeing you next time.